So we'll begin with the last part of the wound healing, okay, which will include wound classification, management, and the medico-legal aspect. Okay. So let's begin. So how do we classify wound based on etiology? Mechanically, it's divided into abrasion, bruise, laceration, gunshot injuries, stab, okay, crush injuries. Depending upon chemical injuries, it can be an acid burn or basic due to a base. Okay. Next comes wound caused by any radiation, lightning. Okay. Sorry. Next comes the thermal injury, which includes the heat and the cold. Now, this is like the overview of the classification. Surgically, we classify wound based on, there is a term called CDC classification, Center for Disease Classification. That's how we divide. Okay? So look at this chart. It's important from the surgery point of view. Here we divide or classify a wound into 4 classes: class 1, class 2, class 3, and class 4. So class 1 includes clean wound, in which case there is no active infection encountered. There is no inflammation in the wound itself. Okay, no to very minimal inflammation. Clear? And in this case, the genitourinary GIT tract is not breached. Means we do not do OT in this tracts. Okay, GI, GU, respiratory are not entered. So you need to know the examples. Okay, which includes hernia, breast, mastectomy. Okay, no need to remember all those things. Just 3 or 4 will suffice. Just the easy ones you remember: hernia, breast, thyroid, adrenal, spleen. Okay, in these cases we haven't entered the GIT or genitourinary or the respiratory tract. Okay. So next comes the class 2 wound, which is also called clean contaminated wounds. In this case, we enter the GIT or genitourinary tract, okay, and there is minimal inflammation. Okay. So examples include cholecystectomy, hysterectomy, nephrectomy. In cholecystectomy, we enter the GIT. In nephrectomy, we enter the genitourinary tract. Okay. In liver resection also, these are the GI surgeries. Okay. So like that, you can remember. Right. Next comes class 3 wound, which is contaminated. You know, while doing any operation or surgery, we employ certain sterile techniques. Okay, like wearing the gloves. Wearing the gloves, okay. After that, how we handle a bowel, okay. How do we resect? How do we excise a tissue? There are certain sterile techniques. So when any of these is breached, okay, that time it becomes a clean contaminated wound, okay. So in this case, what happens is like there is a break in the sterile technique, okay. So when you are operating, there is a spillage of the bowel contents or the genitourinary contents in the surgical field area. Okay. Now, mind you, all these surgeries in class 3 we do in as an elective case. These are not emergency case. Okay. So examples include appendicitis, then bile spillage during cholecystectomy. When you are cutting the gallbladder, there can be bile spillage into the peritoneal cavity. So that time it becomes a clean contaminated wound. Okay. The next includes your amputation for dry gangrene or any rectal surgeries. Okay. So in all these cases, while handling the bowel or the genitourinary, if there is spillage, that becomes a clean contaminated wound. Yeah. Then last we have class 4 wound, which is dirty or infected. In this case, in the wound itself, there is already pus from before, okay, or there is dead necrosed tissue from before. So when you operate on such wounds, it is known as class 4 or contaminated wounds. Okay. So the examples, just remember, is like ruptured appendicitis. Okay. Fecal contamination during any bowel surgery, right? Any or perforation of the viscera, and you're doing an exploratory laparotomy, which we also call as hollow viscous perforation. So all these become contaminated wound. Now you have to remember what is the infection rate in each of these classes. In class 1 it's 1 to 3%. In class 2 it's 5 to 6. Class 3 may it's till 20, and class 4 it's till 40%. Okay, so that is the rate of the infection that can happen in the wound. So we'll come to the management of the wound. General principles. So how do we manage a wound? So first of all, why do we need dressing in cases of any wound? In order to aid the natural process of the body which is trying to heal itself. So we are just simply accelerating the healing process of the body. Then the second is to produce an optimal function and a cosmetic result. Okay, suppose a patient is having a fracture and the limb has been broken in 2-3 parts. So you reduce the fracture part, you do plaster, and you try to correct the deformity into the original state. Okay, so that is the purpose of wound management. So coming to first we'll divide into acute and chronic wounds. So how do we manage them? So any patient with acute wound comes to you, first of all you will do a thorough history. You will ask the patient how did the injury happen. After that you will do examination of the wound. While you examine the wound, first you clean it. So cleaning the wound or is called irrigation. We use normal saline, okay, to flush the wound, and then after cleaning you check the wound thoroughly, okay, for any necrosis or any necrosed tissue, devitalized tissue, any foreign body contamination. So see, when you are checking the wound, you will be handling it with the hand, and you will be lifting up the necrosed tissue, so that time patient can have pain. So in that moment, before exploring the wound properly, you need to give local anesthesia, okay, to numb the pain. So along with local anesthesia, sometimes we use combination of adrenaline. Okay, you must be aware of it in pharmacology. Like we add adrenaline with lignocaine. Okay, what is the function of adrenaline? It constricts the blood vessel, so there will be less bleeding, and at the same time lignocaine will numb the pain. So when you explore the wound, there will be reduced pain, okay, or there won't be any pain, okay. So after giving local anesthesia injection, you explore the wound nicely, okay, you irrigate it, and then you start debridement. Debridement means you excise and you remove the dead tissue, okay. After that you use povidone iodine solution to clean the wound thoroughly. Clear? Then you need to give tetanus and antibiotic. Tetanus to prevent the proliferation of Clostridium tetani, okay, because in the soil or in the road traffic accidents and all, the wound can get contaminated with the spores of Clostridium tetani. So to prevent that, you need to give tetanus injection and antibiotics to cover the rest of the bacteria, gram positive most commonly, okay, or gram negative, whatever. So so this ratio is important. I think you know lignocaine or bupivacaine, that is the local anesthetic agent, along with adrenaline that we use. So adrenaline, the ratio will be 1:1 lakh or 1:2,000. 2 lakhs. This dilution we use in very small quantities. Okay. So that's how we do it. Now, important thing is this adrenaline, which is also known as epinephrine, we avoid in cases of your fingertips, wound in the fingertips, okay, in the earlobes, in the penis, all those areas. Okay? Because what happens is like in those areas you have end arteries. That means there is no anastomosis of the arteries with the surrounding, like there is no collateral supply. Okay? So if one artery is blocked in that area, that part will go into necrosis and eventually into gangrene. Okay? So we don't give adrenaline in these high risk zones, finger, toes, okay, the penis area. Okay, so these things I have explained already. After you anesthetize, you explore the wound, you clean nicely, you pour povidone iodine. Okay, you remove the foreign body, you devitalize, you debride, you cut and remove the dead tissues. Okay, then you start the dressing part. So debridement, so how much should we cut? Suppose you have seen a dead tissue, so how much should we cut? Till you see punctate bleeding appearing. Okay? Suppose you have a tissue, black color tissue, so you're not sure like how much should I cut it. You start cutting it layer by layer till you see punctate bleeding. Once the punctate bleeding starts, that means you have reached the healthy zone or the viable zone. Okay? Clear? So look at this picture. This green color sheet or this blue color sheet that is covering the patient, these are called surgical drapes. So drapes are basically your sterile piece of cloth which is used to cover the patient, okay, except the part of the body that is being operated upon. Okay? So drapes are used to cover the entire body except the part to be operated. Okay? So in this case, in abdominal surgery, we expose the part of the abdomen that is to be operated and the rest of the region is covered. Okay? So all these are sterile portion. So this is a rectal surgery that is about to happen. This is surgery in the leg, okay, and in the chest. And you can see this is the real life image. So this instrument, white color, is called electrocautery, which is used to cut the tissues. Okay? Sorry. So you see they are operating under very sterile conditions. The surgeon is wearing gloves. Okay? These are the surgical drapes or the gown which we call. So once the OT starts, you will come and see it's how we do it. Okay? Then you will get a clear idea. Okay? So when do we need to give antibiotics? We just cannot randomly give anyone antibiotics. Okay? Whenever you suspect any infection, okay, that is about to occur or that has already occurred. Suppose a wound is there, an accidental wound, or now the wound has been open for 4 hours. Okay? Or a wound that has already been contaminated by a lot of dust or any foreign body. In those cases, you need to give antibiotics. Okay? Or if there is surrounding erythema or pus that is already present. So in all those cases, we need to give antibiotics. So as you have studied in pathology, like what are the signs of inflammation is like erythema, pain, okay, loss of function, all those things will also apply to a wound here. So you will look for all these things. Okay? So all these will indicate that the wound has been infected. Okay? Do you know what is cellulitis? Anyone? What is cellulitis? Cellulitis is like non-purulent infection of the skin and subcutaneous tissue. Okay? There is infection of the skin subcutaneous, but there has been no pus formation yet. Okay? That is called cellulitis. Erythema, all of you know. Okay? Redness, swelling, purulent discharge, all this will indicate infection. Okay? So that time you need to give antibiotics. Okay? So let's come to the dressing part. So what are the advantages or what is the purpose of dressing? It provides an ideal environment, just like a greenhouse, okay, providing a moist environment to accelerate the wound healing process. So when we do a dressing, it's kind of a physical barrier, just like a skin, so that external additional trauma cannot go inside and exacerbate the wound. Okay. First point. Second point is it will provide a moist environment inside, which will prevent the drying up of the tissues. Okay. Once the tissue gets dried up, it will die eventually. So to prevent the drying up of the tissues and to let the antibiotics act in a local environment, we need to do dressing. Okay. So third point is when you do dressing, we apply some form of compression. So when we compress, that will limit your inflammation, okay, or swelling formation. And moreover, we use dressing pads, okay, during the dressing procedure, which will absorb your excess fluid that happens because of the inflammation. Whenever there is a wound, there will be inflammation. So in inflammation, there will be lot of exudation. So that fluid will be absorbed by the dressing pad. So these are the function of wound dressing. Yeah? So all these things I have told. Pain control, odor control, cost effectiveness, these are self-explanatory, nothing to explain in that. So management of chronic wounds. So whatever principles we apply in cases of acute wounds, similarly we will apply in case of chronic wound. But the difference is you need to take a biopsy in a chronic wound, because a wound that is not healing, you should always suspect malignancy. Okay? So we need to do a biopsy and we need to check if there is malignancy or not. Okay? Apart from that, the rest of the things, antibiotics, dressing, all these things will be same. Additional things include graft that you can put, okay, or a flap. Flap is a thick chunk of tissue which we extracted from the same person or a different one to cover a very big wound defect. And flap, we basically mean a skin flap, which is a very thin, like a sheet of tissue, okay, which is used to cover a wound. Clear? So there is a difference. So we'll just briefly touch upon the medico-legal. It will be explained in details in the forensic. So definition of injury, okay, according to IPC. So just these two are the extra ones, legal and medico-legal. So in legal, we divide it into simple and grievous hurt or injury. And in the medico-legal, it will be homicide, suicide, accidental, or self-inflicted. So we'll just briefly see what are these. So in the legal classification, the section 320 IPC defines the grievous hurt, okay, and comprises of 8 clauses that the forensic doctors will teach you. Okay? So anything which is not grievous, it will be simple hurt. It doesn't have a standard definition in the constituency. Okay? Right. So these are the examples of grievous hurt. I think all of you are already familiar with that. Okay? Amputation of the penis or any permanent privation or damage to the eyesight, okay, hearing, okay, permanent disfiguration of any part of the body, okay, all those things. Privation of any member or joint, okay, castration, all these will include grievous injury. So medico-legal classifications, these are the 5 broad categories in which we divide. Clear? So abrasion, it includes only the superficial layer of the skin. Okay? So after the epidermis is removed, there will be very minimal or no bleeding. Okay? And there will be a scab formation. Scab is basically your dried plasma. Okay? Along with RBCs, WBCs, all these things will form a superficial, thick layer, dried layer of tissue. Okay, so it includes scratch, graze, pressure, and imprint. Okay. So, what is the medico-legal importance of abrasion? First of all, you can know the cause of the injury, the direction of injury, and by the abrasion will undergo some color changes as the days pass by. So, according to that, you can know the approximate time of the injury. Okay, so if there can be a possibility of infection or not, and sometimes burn injury will also form a differential diagnosis. Okay, in case of abrasion. So these are the four pictures that I have put up here. This is scratch, okay. This is graze. This is pressure abrasion, and this is pattern. So in this case also, when you remove, this is a case of hanging. When the rope is removed, that time you can see the pattern of the rope on the neck of the patient. So this example will also include pressure along with pattern abrasion, just like this. Okay? There will be pattern of the rope on the neck. Okay? So age of abrasion, how do we calculate? By checking the color. Okay? So when it's fresh, raw, without scab, it will be less than 12 hours. Okay? From the point of injury or the time of injury. Okay, next is reddish scab, 12 hours to 3 days. Then after that, it will become brown, more than 3 days, 2 to 3 days. Brown scab, 4 to 5 and 6 to 7. So after the abrasion, it will slowly start to heal. So once the healing process starts, initially it will be depigmented. Okay? Then later on, the melanocyte proliferation will start and it will regain the original skin color. Okay? So next is your bruise. So it's basically your accumulation of blood in the subepidermal or in the epidermal or in the like below the skin, subcutaneous, in the dermis or in the subcutaneous skin. That is called bruise or contusion. Okay? Which happens because of blunt injury. So the skin is intact in cases of bruise. That is the important thing. So these are two pictures, okay, of bruise. You can see here it's clearly demarcated in this case, where here the margins are not demarcated clearly. Okay, it's a bit of irregular. So you see the types: intradermal bruise. Okay. Hemorrhage is sharply defined. That is the main point here. So if you see this picture, this will be an intradermal bruise. Clear? Because it's sharply defined. The subcutaneous bruise, the edges are blurred. The second picture that you have seen, this one. Right. And then last is the deep bruise. It's deeper to the subcutaneous even. Okay. So these things will be taught again. Okay. So these are the color changes that you see in bruise. Okay. Initially it will be red, then it will become darkish brown, black, then slowly it will be fading out. So depending upon the color changes, you can know the age of the bruise, just like in case of abrasion, exactly same. Okay. So fresh will be 0 to 2 hours, then early stage it will be 1 to 2 days, then 3 to 5, up to 7, and in the second week it will be almost gone. Okay? It will be like. So laceration will be rupture or tear or split in the skin or any organ, muscles, whatever. Okay? So when laceration is like extensive and it involves the deeper tissue, it is called crush injury. Okay? So laceration in a bigger scale, and when it involves the deeper tissues, okay, it's called crush injury. Okay. So types of laceration will be split, stretch, avulsion, tears. Okay. You know what is Degloving of skin. When you remove a glove, the manner in which the glove comes out, when an accident happens, in the same manner, if the skin is peeled off, just like you're removing a glove, that is called degloving. Clear? So medical legal aspect of laceration will be, you can know the cause of injury, okay, and if there is a pattern, even the shape of the object can also be ascertained in that. Whether it is antemortem or post-mortem, okay? If it's homicidal, it will be mostly on the head, okay? So ending with a beautiful picture just to ruin your day. Okay. Class over. So we'll finish up here.